Good afternoon. Today, we, the group number 4, Occupational Health and Safety, includes Prince, Tanvi, Angel, and me, that's Smile. We'll be talking about occupational health and safety in human resource and management. So, to begin with, the Occupational Health and Safety Act, OSHA, which is a key component of legislation aimed at ensuring the safety, health, and welfare of employees in the workplace. The main goal of OSHA is to protect workers from hazards and ensure that employers provide a safe and secure working environment. OSH is directly impacted of being HRM because it is crucial component of well-being and productivity of employees. HRM is responsible for ensuring that the workplace environment is safe and beneficial to employees' physical and mental health. This responsibility includes compliance with laws and regulations, implementation of safety programs, and addressing any workplace hazards. Failure to inadequately manage OSH can lead to higher absence rates, reducing employee morale and large financial losses due to compensation claims and legal fines.
Employee obligation regarding OSH. Employer and employee obligation in occupational health and safety are crucial for secure work environment. Employers must provide safe conditions, conduct risk assessment, and comply with OSHA regulations. Employees need to follow safety protocols, use PPE, and report hazards. Both rules are essential and complementary in maintaining workplace safety. Employer obligation in that training and education, provision of PPE, providing safe work environment, compliance with legislation. In that providing safe work environment, employers are legally required to ensure that the workplace is safe and free from hazard that could cause injury or illnesses. This involves regular risk assessment, implementing safety protocols, and ensuring that equipment and facilities meet safety standards. Compliance with legislation. Employers must comply with federal, provincial, and local occupational health and safety regulations. These include maintaining proper documentation, conducting regular safety audits, and follow the safety standards specific to their industry. Training and education in that employers are responsible for providing ongoing health and safety training to employees. These include training on the proper use of equipment, emergency procedure, and specific safety practice relevant to their job. Provision of PPE in that employees has to provide the PPE to employees at no cost. They are also responsible for ensuring that PPE is properly maintained and replaced when necessary. Employees' obligations in that follow the safety protocols, participation in training, reporting hazards, and maintaining personal safety. Next slide, please. Uh, Follow the safety protocols. Employees are required to follow all safety protocols and procedure established by their employees. These include using PPE as instructed, operating machinery safely, and follow the workplace safety rules. Participating in training. Employees must actively participate in health and safety training programs. Reporting hazards in that employees have to duty to report any unsafe condition or hazard they observe in the workplace. This can include faulty equipment, unsafe practice by colleagues, or any other potential dangers. Maintaining personal safety. Employees are responsible for taking reasonable care of their own health and safety while at work. Next.
So, moving on to how COVID-19 has impacted on occupational health and safety in regards to personal protection equipments, PPEs. The emergence of COVID-19 has incredibly affected the occupational health and safety, especially in aspect of PPE. Due to the newness of outbreaks, several measures have been taken to safeguard the lives of employees, especially the frontline workers. COVID 19 has drawn the attention to the importance of PPE during the virus outbreaks, at the same time has significantly affected the current occupational health safety both positively and negatively. During the start of COVID-19 pandemic, there were more demands of PPEs for the workers. However, the demand led to stockouts that exposed weak links in the supply chain and inability to brace for the pandemic. And the sufferers were especially the healthcare sectors. For instance, PP that's experiencing high stress levels as well as anxiety over their safety as well as the patients that are bound to attend to it. To invert any kind of lawsuits, organization had to roll up out the proper training for the personal guarantee adequate for the protection.
So now we are going to see some of the major issues that caused during the COVID due to PPEs. The first one is shortage of PPEs. The high demand of PPEs during the pandemic led to shortages, putting health workers and other essential personnel at risk. The second one is inadequate PPE training. Some workers may not have received proper training on how to use PPE correctly. That's why leading to potential exposure to the COVID-19. The third one is discomfort and fatigue. So prolonged use of PPE can cause discomfort and fatigue, affecting workers' productivity and well-being. And fourth one is increased cost. Employees may face increased cost due to the need to provide adequate PPE for their employees. Next, the fifth issue is compliance challenges. Ensuring consistent compliance with PPE protocols can be challenging, especially in fast-paced or high-stressed environments. The next is psychological impact. So, wearing PPE for extended periods can contribute to feelings of isolation, anxiety, and stress among workers. Next, maintenance issues. Proper maintenance and disposal of PPE can be complex, requiring specific protocols to prevent contamination. And the last is risk of contamination. Improper use of improper use or disposal of PP can lead to the risk of contamination, potentially spreading the virus further.
Next is consequences of stress. First of all, workplace stress is very common. There are two types of stress: positive, which is also known as eustress, and negative stress, which is also known as distress. Positive stress is healthy as it brings innovation, creativeness, accuracy, personal growth, and development. It motivates the employee to finish the given work within time limits with effectiveness. Ultimately, this kind of stress is beneficial for organizational growth. On the other hand, negative stress causes mental and physical workload, burnout, reduced thought process, thinking ability, and in result, it decreased productivity, which is hazardous for overall organizational productivity. There are certain consequences
which is positive and negative. So, first of all, positive consequences, um, which include the enhanced performance, productivity, resilience, innovation, and motivation. Let's take an example of current situation of NLM students. We have a lot of assignments due, but deep down we know that we are very near to completions. That brings motivation, encouragement, creativity, and innovations to make an assignment in time limits. Next is negative consequences of stress. So, negative consequences bring mental and physical problems which makes us burn out. Workplace conflict may arise between the employee and employers to increase the productivity, but it may cause the mental and physical problems and also decrease the productivity, and this uh, incomplete work leads to increased absenteeism.
So, in summary, we discussed about the OHS, that is Occupational Health and Safety. Then we discussed about the OHSA, which is Occupational Health and Safety Administration and its regulations. Also, we discussed about the employer and employees' obligation at workplace to maintain safety. Then later we discussed about the issues occurred during COVID due to the PPE such as discomfort, fatigue, risk of contamination, etc. Lastly, we discussed about the positive and negative consequences of stress. Thank you. So these are the references which we used for our content. Thank you.